talk about the Delta Plus variant. So the Delta Plus variant has been found in about 9 countries so far, and including in India, it has been found in 3 states in various districts of Maharashtra, of Kerala and Madhya Pradesh. 22 cases in fact have been found in Maharashtra. So right up till this evening, the Delta Plus variant was being described as a variant of interest. In fact, in the Health Ministry briefing that took place earlier this evening, the Niti Aayog representative, Dr. Paul, very specifically said so far it's a variant of interest, but we're watching it very carefully. Later this evening, we have heard from the Health Ministry, and in a statement to the states, they are calling it a variant of concern on 3 parameters, and they have asked for containment measures to be put in place in these states to make sure the Delta Plus variant doesn't spread. So what exactly do we know about the Delta Plus variant? Moreover, can we make sure our vaccination drive keeps up the pace required so that the Delta Plus variant and other variants that may come about get nipped in the bud? Yesterday we did over 80 lakh vaccinations by this time. Today is a little over 50 lakh vaccinations. It's still better than the average pace of between 25 and 30 lakhs a day that we were seeing before that, but we need to keep up the pace because the aim is for 1 crore vaccinations a day. To speak on this and a host of issues with vaccinations and variants, I'm joined now by Dr. Lekha D. Bhatt, who's Assistant Professor, Department of Epidemiology from the Central University of Tamil Nadu. Dr. Bhatt, welcome to the show. Great to have you on this very important subject. Let me first ask you what we know about the Delta Plus variant, and should we be concerned? The reason is that the Delta variant itself and the whole second wave started in a similar, very limited fashion, with a few cases being reported initially from Gadchiroli district in Maharashtra. And clearly the concern is that we don't want to repeat and a spread of the Delta Plus variant.
Thank you so much for giving me an opportunity to be part of your show. This Delta Plus variant is a new concern that is identified in the last 1 week or so. The cases are mainly reported from Maharashtra, Madhya Pradesh, and Kerala and Karnataka. As of now, the cases are very limited, and we don't have enough of samples to do the genome testing and find out whether it is so virulent and what will be its permissibility and what will be its severity. So as of now, the government has not considered this as a major public health concern. So as of now, we have to wait and see what will be its impact. But considering the examples from other countries, the similar virus variant is found in other countries, Portugal and some of the other European countries, which have not given a severe warning signal. So as of now, I think we can wait and see. Meanwhile, more samples have to be collected and genome testing have to be done.
You know, what do we know about the Delta Plus variant so far, ma'am? Now, especially when, the government and the Health Ministry in its statement are saying that it has higher transmissibility. They also go on to say things like it, can cause greater lung infection, so stronger binding to receptors of lung cells and potential reduction in monoclonal antibody response. Can you explain to us in lay terms what this means?
See, whenever any new variant is coming up, it is generally the way the government responds. It will give the maximum possible warnings so that people will adhere to the protocols, social measures, and other public health measures that are being taken in the country. So giving up warnings and stepping up the preparation is very natural. And that has to be done. Then only will be preparing the public as well as the healthcare system of the country to meet any of these emergencies. So that is very natural. So this Delta to Delta Plus variation has occurred. And as of now, the report says that it is a new version that is found through routine scanning variation of the Delta. A small number of detected sequences have acquired a new spike of protein mutation K417N. So as of now, preparation have to be stepped up, and we have to wait for the reaction of this particular new variant.
Okay. Anand Bahan, how do you look at this, development that we've seen in the last couple of hours as far as the Delta Plus variant is concerned? There is now a warning saying that please contain this for these 3 states. So what is the implication of that on the process of unlock? What is the implication on that on the possible spread of disease?
Thank you for having me. So, again, as we know, variants keep happening, mutations keep happening. What is worrisome perhaps with this particular development is that there are concerns that this might perhaps be more infectious. We need more data. It might also have a reduced response in terms of the monoclonal antibody treatment, which is now being licensed for usage in India. So certainly, if that indeed ends up being the true case, that it is more infectious, then we need to worry about the fact that we are having unlock happening at the same time when cases are popping up. Fortunately, so far we only have a handful in a few states, but if we are not careful, then again we've seen the waves tend to spread very fast. So I think what's really important at this point of time is a few things. One is that, of course, we need to step up our genomic surveillance, especially on the positive cases, to keep track of the spread of the Delta Plus variant. The second thing is we really need good quality field effectiveness studies to understand if there is any impact on vaccination. As you remember, there have been some concerns about the Delta variant and the effectiveness of some of the vaccines which are currently being used in India. So we really need to know, is 1 dose good enough? Do you need 2 doses? Even with 2 doses, what is the kind of effectiveness you see, especially with the newer variants of concern? And that should help guide policy. So if we start seeing a lot of cases cropping up, one would suspect that we will start seeing some control measures being instituted, because you certainly don't want so much early into unlock to start facing the kind of problems we saw a couple of months ago. So certainly time to be cautious. I don't think we need to get unduly worried right now because the cases are limited. But this kind of scientific workup is exactly what we need. The sooner we identify these kind of variants, the better we can do in terms of control. So yes, absolutely, micro-control is what we need at this point.
Now, so Anand, do you think that we're doing enough genome sequencing? Because that has been a constant complaint, that are we checking enough for newer variants as a percentage of the cases that are cropping up? And would you hope for more transparency in this regard?
No, I would certainly want more to happen, and I think one of the problem, is the constraint, which is that there are not too many labs which can do these kind of analysis. They are located perhaps more in the metro regions. We need more labs perhaps in every state. If we had state-level capacity building in a way that these kind of analysis could be done in every state, or at least in all of the major states, then we would be able to turn around our processing of the samples much more faster and help guide local policy making. If you keep shipping samples to centralized labs or a limited number of labs, then of course you will always have these constraints. The second thing being how much of our samples are being processed for genomic sampling. That number needs to go up as a percentage of all of our positive samples. So we certainly need to enhance our capacity to do genomic, epidemiological workup, and that is going to hold us in good stead for the future as well. Because when we build up that capacity, it's not just for COVID-19. Genomic sampling, genomic surveillance is something which will be very useful for us moving forward, even for childhood diseases of many kinds. We know that there are many genetic issues in many parts of India. There are issues like sickle cell disease, etc., which can all be effectively, responded to by mechanisms such as genomic workup. So the more capacity we have.
Yeah, absolutely. No, Dr. Lekha. Yeah, Dr. Lekha, what I want to understand from you is how difficult is it going to be to contain a new variant which is already, a variant of a highly transmissible one. Delta Plus is also been marked as a highly transmissible variant. It's been found in 3 states, in some districts so far. So what is the extent of challenge that policymakers will face right now to make sure it doesn't spread further?
As of now, this is found only in small, limited numbers. Incident is very low. However, if we are not able to control it now, it might cause more severity and more transmissibility. So, stepping up the genome sequencing and testing is the only way that will be able to identify more about this particular virus and develop containment strategies accordingly. And as unlocking is happening in all the states in a partial phased manner, this is going to be a big challenge. And another important thing is not to be panicked. Obviously, we need to do the test and we need to get the samples, but stigmatizing a particular place or a particular state, it should not happen. That is why the new names are given alpha, beta, delta, so that the countries are not stigmatized. Same way, our states should not be stigmatized. Then sample collection, everything will become problem. So this has to be dealt in a very careful and planned manner.
Yeah, no, there is. Yeah, I'm joined now by Dr. N.K. Arora, who's the chair of the Entagi COVID subcommittee. Dr. Arora, great to have you on the show on a day when we're also discussing the pace of vaccinations and how we can reach 1 crore a day. But before that, I want to ask you about this latest statement which has come from the Health Ministry with a warning on the Delta Plus variant. The question is, will our current lot of vaccines work against the Delta Plus variant? Do we have enough information about this?
Thank you very much, Tamanna, for calling me. There are 2 or 3 things. One is, first of all, I think what Lekha was saying, we should not stigmatize either the variant, so-called the new strain of virus, or the place, or the state, or the country. As of today, we have got 22 cases. And a lot of these are from different cities in Maharashtra. And concurrently, the studies are being done to look at 3 dimensions. One is its transmissibility. Second is severity of disease. And third is its impact on vaccine protective effect. These are the 3 things. And now INSACOG is working in a manner. See, it is not the number of strains which are sequenced. It is not that. It is the representativeness. Means if I am getting 4 lakh cases, 5% means 20,000. It is not, it is madness. It is not required. You need to be very strategic the way sampling is done. And then we have a mechanism now that every part of the country we have divided. There is a method. I think very soon it is going to become public and we are going to share with you. The more important thing is that wherever we see something unusual happening, and what are those unusual things? One is we find a virus which is different from the others, which is we call variant. And this has been picked by our scientists. So it is not that it is not under scanner, it is being picked up. Second, then one has to look at whether transmissibility is in terms of rapid expansion of the cases in that area. Now, last time when Ratnagiri and some of those
All right, I seem to have lost Dr. Arora's audio there. We will try and get him back. But, the key point being that we should not be overtly concerned till we have more information. We'll try and get him back to understand exactly what are the properties of Delta Plus that makes it more scary. Meanwhile, Anant, let me come to the other big question on pace of vaccination. So yesterday we did over 86 lakh vaccinations in a day, a new record. Many were talking about how we have vaccinated maybe the size of a small country all in one day, which was fabulous. The latest data that I have checked on the CoWIN site and the dashboard shows that we've done a little over 50 lakh a day. Will it be a challenge to keep up the pace in your view, Anand?
Well, I mean, first of all, I think we should be very appreciative of the numbers we saw yesterday. I think, we should congratulate all the stakeholders involved. It's obviously required coordination between the centers, states, vaccinators, a lot of people contributing in many ways to enable that. And I think that's a cause for celebration. That having been said, we need that kind of campaign on a regular basis, almost on a daily basis, to get adequate coverage. And I think it is possible. We've seen that yesterday, that we can get such high numbers. Fortunately, we're seeing now a very good response from the communities as well. So when you have uptake happening, you have good quality supply, you have the enablers of, and then you can certainly see these kind of high numbers. It's certainly going to be a challenge if supply constraints crop up, but I think that is something which Professor Arora and many other of our senior health system folks are trying to address, but hopefully we will not see any stock outs or a reduction at times, because that obviously hurts the prospect of getting adequate vaccine coverage. But I'm very happy about what we saw yesterday. We need to keep this momentum going. The one concern I do have is that while we keep obviously this momentum going, our existing non-COVID related services should not be impacted, especially on the vaccine side, because of course our under 5 kids, our pregnant women, all of them also need their vaccination. And that is of course also delivered similarly by frontline healthcare staff. So overall, again, great that we saw the numbers yesterday. We need to keep that momentum going. Hopefully we will see more of that.
Yeah, Dr. Arora, let's begin with the Delta Plus variant and the statement issued by the Health Ministry today. How much should we be concerned?
It is an issue which needs to be kept at the back of the mind, and something which our people should not let the guard slip down. The reason is that we have just come out of a very ferocious outbreak of Delta variant, and now we have seen Delta Plus. There may be possibility of this becoming also very bad, or it may just disappear after some time. At the moment, it is difficult to say, but it is being watched very closely, and as you can see, there is a daily count which is being kept, and it is released to the press also. There were 6 cases 4 days ago and 22 cases today. I think it has been, and a lot of cases are in Maharashtra. The second thing is that I was talking about 3 things: whether it is more transmissible, second, whether it is more causes more serious disease, and third is what is its impact on the vaccine. So transmissibility, it looks like it may have transmissibility, but I think it is too premature at this time. Severity is being watched. Whatever patients have been seen so far, they are being followed up very closely, but they are too few. So to make any significant comment, it is not correct. And the third thing is that studies are already on to look at the impact of this variant on the vaccine efficacy. Now, vaccine efficacy, I would like to assure all of us, all of our audiences, that vaccines have 2 aspects of their protective role. One is visible, the other is invisible. Antibodies are visible, and neutralizing antibodies, many times with variants, it has come down. But there is an invisible component which is called T cell. And what has been our experience before, that even when neutralization comes down, the T cell is good enough to prevent serious disease and hospitalization. And I think that's a very important component. Ultimately, we know that in a usual case, it's like a mild common cold kind of a illness. But if it goes to become serious, and which cannot be predicted most of the times, then it is really worrisome. But both our vaccines and the coming vaccines also will have this opportunity, this property, that it will prevent serious disease and hospitalization and death. So as far as vaccination is concerned,
So
it is
Dr.
very
Arora,
heartening.
let me repeat one question. Okay, let me just ask specific question on what was said in the statement today. And I asked you this earlier, but we had a poor line. What does it mean when they say that Delta Plus has a stronger binding to receptors of lung cells?
Yes, it because of the mutation, it binds more strongly to the lung cells, but that does not mean that transmissibility is increased in the process. The reason is that transmissibility is also in terms of how much it proliferates. So if I get infected with Delta Plus, if I am producing a lot of virus and then transmission means I must be able to give it to the next person sitting next to me. So it may get stuck in my body and may not proliferate so much to cause. So these are all open questions, and in coming days and maybe a couple of weeks, we should have more answer on that. So just talking about it has a greater affinity for lung cells may have too many meanings or no meaning at all. It may also mean that we do not know what is the severity of the disease. So I think at the moment we should just keep it at the back of our mind, and a lot of work is going on. Now there is a very systematic way when genomic sequence is done, when virus is isolated, immediately 3 types of studies are put in motion, and which I have already mentioned.
Okay. Let me ask you the big question about pace of vaccination, which is the important one. Yesterday we saw nearly 86 lakh people vaccinated. It was day one of the new system where the central government is giving vaccinations to everyone for free. Today was day 2. We saw a little over 51 lakh people vaccinated as per the latest data live on the COVID dashboard. Do you think this 86 lakh and then 1 crore per day number is achievable? Do we have the supply to match it?
So you're asking 3 questions. First question is, can we sustain this? Do we have the infrastructure? And third is vaccine-related accessibility. So as has been repeatedly said during last four weeks or so, that a vaccine pipeline is now ready so that we should be able to have sufficient vaccine in coming days, weeks, and months. The ultimate target is that by the end of the year, most of us should be immunized. And the second is infrastructure. So I do not know whether you have looked at the COVID platform. It gives another very important information. Yesterday, there were 67 or 68,000 immunization centers. Today, there were 52,000. Now, our capacity is going up to 100,000 in public sector. Private sector was only about 2,000 yesterday, and today also it is around 2,000. We expect that with this 25%, which is supply, which is mostly urban, we should have many more private sector, and this will be a great example of public-private partnership. The public sector, 2/3 to 70% of this is in rural area. So even today, when I'm talking about 50,000, I must assure you almost 35,000 centers must be in the rural area. At the moment, it is not given, but most of it is in rural area. So we have, I would recall, I have told once again previously that India is able to immunize 17 crore children in 1 week. So almost 2 or 2.5 crore children every day as part of Pulse Polio program. So we have the capacity, and now there is political will, there is vaccine, infrastructure. COVID platform maintains not only the line listing of individuals, but it also maintains supply chain. You can get exact information up to the vaccination center, how much vaccine is available at that. And then now the major important, and I think that a major thrust has been put in on social mobilization and trying to demystify and debunk the wrong messages and the rumors which we have been hearing a lot. And it is so heartening that people are coming. Even today, till around 9 o'clock, as you rightly said, 52 lakh people have already been immunized.
Yeah. No, we need to keep up the pace, no doubt, and we need to keep up the supply as well, have all hands on deck. As far as vaccines are concerned, that's the only way to make sure variants are at bay. Thank you so much, Dr. Arora, for joining us and giving us all those details on a very important story. We'll take a very short break here on the India development debate, but we're back with the big picture with Ramdev Agarwal. Stay tuned.